Hello and welcome to today's episode of Community Connections, airing right here on OROMIA11. I am your host, Anna Orr. Today we're talking about a very important topic, the opioid awareness addiction issue in the United States. Among Black men aged 31 to 47 years old, the ITSA estimated overdose deaths are projected to double to about 104%, rising from 3,960 in 2020 to 8,070 in 2025. Similarly, overdose deaths are expected to rise sharply amongst Black men aged 48 to 64 years old, from about 4,720 in 2020 to about 8,850 in 2025. That would be the rise of about 88% before this next year. Today we are talking to two executive directors of one of the leading rehabilitation centers in the greater Twin Cities area. This is going to be a really important episode. Grab someone you care about in your network and tune in. You won't want to miss it. Today's guests are no stranger to the community or the greater Twin Cities area. Eric Bacon and Ivan Nelson, thank you for joining me on this episode of Community Connections.
Quite welcome. Thank you for having us.
Now, for those that are unfamiliar with both of you, can you just introduce yourselves and your roles within your respective organizations?
Go ahead, you go, Ivan.
I'm going to go first. My name is Ivan Nelson. I'm a co-founder and executive director for African American Survivor Services. We are a community organization and aspiring RCO that does a lot of work in the metro area. That's Ramsey, Hennepin, and Washington County. Excuse me. We provide services and referrals to services for anyone, any survivor of domestic violence, intimate partner violence, addiction, or homelessness.
Okay. And you, Mr. Bacon?
I'm Eric Bacon. I'm the founder and director of Continuum Care Center, which is a recovering community organization in St. Paul, Minnesota. We also have offices in Minneapolis on Broadway and North Minneapolis. We provide peer support services, housing support services, naloxone trainings, and trainings with harm reduction and other trainings around the community in the 12-city metro area. So we've been all over providing services since 2016.
Wow. Both of you, welcome to the program.
Thanks for having us.
Now, we are talking today about the overdose forum that is taking place on the 23rd of May.
Yes.
Can you talk to me about where the vision for the Black Addiction series came from?
Oh, I can take that. So we were involved, African American Survivor Services, we were involved with a body of research working with Dr. Kumi from the University of Minnesota on taking a look at, why are Black folks more prone to being prescribed methadone as opposed to Suboxone. Suboxone and methadone are both of those drugs used to prevent continual use of opiates. And so part of the medication-assisted therapy. And so we were looking at those numbers, and in that research and the time that we spent with the participants in that research, we started to, and as a result of the research, we saw that Black people were at 9% or higher, more likely to succumb to a fatal overdose from opiates than their white counterparts. Right? In fact, 3% higher than Native Americans or any other groups. So we wanted to kind of get a deeper dive into what was driving that. A lot of folks talk about addiction in the sense of, the drugs that are being used and things like that. And so as a group, right, we wanted to kind of understand what was driving the pain. Everyone wanted to talk about the addiction. No one wants to talk about the pain. So that's kind of set the stage or the table, if you will, for our decision to start this series of discussions.
Now, seeing as this is the first of the series on Black addiction, can you talk to me about how it kind of came to be and how you guys navigated this inception?
Well, African American Family Service, Ivan, who had the vision to host this through his talks with the doctor. And so we decided to collaborate on this first event, and we've talked about collaborating on more in the future and using other providers too to bring this series about, to address the problems in the community.
Now share with us, who is the target population for this specific forum?
The target audience for this event is professionals. We think that addressing professionals with some of the knowledge and what we have seen in this, addressing some of the stigma, addressing the harm reduction, and some of the cultural services and the MAT and substance abuse avenues, and giving some things that we've seen, addressing it from that standpoint.
Okay. Now, for those that are interested in coming in our professionals, are you all open to partnering alongside with them going forward in this series if it's a good fit? Or
as Eric mentioned a little while ago, so we look forward to onboarding other folks. That's why we for this first part of the series, we had a slant toward inviting professional providers first, right? So with the hope of raising awareness. Some things that they may have not been looking at, and then the hope is to potentially partner with them or bring them along, because we understand that it takes all of us, right, to deal with this atrocity, if you will.
Talk to me about who will be there speaking on the day of the forum.
That was really interesting. You want to take it?
You go, because you know.
So we have a really interesting mix of folks. We have Dr. Bob Levy, who is a really interesting gentleman. He does a lot of work with the U of M and Broadway Family Medicine, and resident of Broadway Family Medicine. He's also someone, and I hope I'm not really breaking his anonymity, but he's really open about some of his own lived experience with addiction and being in recovery, right? And we also have Kenneth Jackson, who is the director over at Ethos. When I chose to look at Kenneth is because he was one of the first African-American men that had a directorship at Hennepin County Family Medicine. Hennepin County Addiction Medicine, which is a medication-assisted therapy organization. Right, and that was back, almost 20 years ago, right, when it wasn't really popular to have a discussion about. That was back when the Oxycontin was on the forefront of things. So Ken will be there, and then Turning Point, right, which is the oldest black treatment provider, right, in the state.
I think that's very important.
And then, of course, Continuum Care, right, who's always present, and do amazing work over there.
I agree with you. Now, I want to shift gears just a little bit. Seeing as May is Mental Health Awareness Month, how have you two gentlemen seen the landscape of addiction and mental health run coincide with one another in the community?
So, I think they are hand in hand. It's just like the chicken and the egg. We don't know which one comes first. It's hard to assimilate them sometimes, and sometimes you can't see it because of the addiction, and vice versa. So it's very important that that you address it from a standpoint of both of them at the same time. Those mental health and substance with co-occurring services. Right. So yes, and it's I think it's a part of it. I just don't know which one is first sometimes.
Exactly.
You have to. So you have to address them on the same platform.
Exactly. If I can echo what Eric was saying, is a lot of our street outreach work. And so when we are talking with folks, that of their own volition say, hey, Ivan, hey, Kenny, or one of the people that are working on our teams, after a series of engagements and building that trust with them, and it's I'm really thinking about, treatment, right? I know exactly the program and the staff over at Continuum Care, right? So, so giving folks that assurance, right? And then I know the model that Eric uses at Continuum Care, right? It's not something that's really demanding, right? They're not, so it's really person-centered, He was talking about, saying co-occurrence, and what continuum care does, I believe, better than anyone. Nobody hold me to that, right? But they do a fabulous job of treating both mental illness and addiction in tandem, right? And that's key.
How have you seen the work of those two things improve someone's life? Because I know there are some programs that offer it separate. You can seek therapy separate or a psychiatrist separate, but they're saying we're going to treat whatever your addiction is.
So we do the supportive side with the Continuum Care Center. So the treatments that we deal with, which is other treatment, I also own a treatment center too, but I don't use it specifically. It's just according who the client is. But we would make sure that we refer the client to appropriate services that's going to address his or need individual. Because I think that it's so many programs that do a wonderful job, but they don't fit all of our clients. It's just like the OROMIA, the East African community, and those, I think they find it very hard to address issues with mental health and substance abuse due to cultural reasons. You know what I mean? And a lot of programs, they say they cultural specific and use appropriate services, but sometimes you don't find that. And it's so much needs. And so that is one of the things that we want to address with this forum is, and that's from the standpoint of which we try and address things, of talking to professionals about what those appropriate cultural services look like for a client from the East African community or other communities that suffer from mental health and substance abuse, and how do you address that with all the stuff that they have to deal with, is stereotypes and assimilation and just, so many things they have to deal with. So I think that's key. So
now, in talking about cultural appropriate care, can you kind of expound about the multiple prong learning objectives you all will be sharing at the forum? You talked about stigma, harm reduction. You talked about MAT and SUD. You also shared about a few other things. Can you expound on what MAT and SUD is for people that may not know?
MAT is medication assisted therapy.
Okay.
Or it's a MOUD, also acronym for medication for opioid use disorder.
Okay.
All right. And this is your methadone or Suboxone provider, right? SUD is substance use disorder. All right. The four-prong approach, right? We feel, for this sector of the series, right, kind of embody everything, especially as we address professionals. Something that Eric was saying, and it continues to stick out to me, that we will cover is some providers, right, either due to lack of education or certain personal or professional biases, right, fail to, the delivery of services, bless their heart, right? It's just not, because and I say that, with good reason, because we're seeing that, black men and women are entering treatment, and this was a number that's trending now, are entering residential treatment and are staying less than, this is a 28 to 60-day program, they're staying less than a week, right? And we're trying to understand what is going on there. And so a lot of times, going back to addressing trauma, right? Trauma decontextualized looks like personality, right? And so if a person is coming in there especially our younger black men, someone from the East African community, right? That come from these environments where trauma is very apparent, right? Or kind of sort of normalize it, right? So the counselor, right, that may not look like them or have any cultural depth, right, that they may have, right? There might be some sort of conflict, right? And so they feel unheard, right? Discounted, right? And they'll leave and go out the front door. These are folks that are, on conditional release from prison or jails, right? They're mandated to go to treatment, you know. So they're really willing to take that risk.
So with that said is that, and I think I haven't said it in a very nice way, but what I'm gonna say is that it's always been that I've noticed since my many years of being in this field, over 20, and working with this population and people, is that what I know today is that we can do them, but they can't do us. And that means I'm talking not to, to put anything down, but just to be honest, is that we haven't been assimilated to their culture, and they haven't been assimilated to ours. And so they keep banging on the door, but they don't know that all they have to do is just, push the button, you know what I mean? And come at we need to have a different approach to work with us.
Yeah.
You know what I mean? Because, we different than them. Our culture is different. And like I said, we have assimilated to theirs. We pick up all of their habits and the things they do. And I'm talking about Caucasian or white or whatever, and not to put it down because they are great providers in that thing, but if you don't know, you don't know.
That's true.
So this event is something like that to address some of those issues from a stigma, which we're gonna go and address issues with, biases, personal biases. Don't be afraid to say it. Don't be afraid to ask a person about their biases and they say they don't have one. Okay, we want to address harm reduction from a professional standpoint. We know about harm reduction, giving clean needles and doing all the stuff we do in the community.
Right.
But I'm talking about how professionals can harm clients. They harm them. That's why they running back out there, because of professional harm sometimes.
I think it's very difficult to hear that people are leaving after a week for such an extensive program. Because if you think about it I'd say in thirds, you're not even getting enough to get you going before you've left the program.
Yeah. I've worked as a clinician, right, for 16 years, right? And if memory serves me correctly, I can count numerous times a person will come in for that assessment. It's no longer Rule 25, but chemical health assessment, right?
Yes.
And they'll sit there and they'll tell you exactly what they need, where they want to go, right? A level of care. They already have it in their mind. And I would very politely say to them, I was like, okay, thanks for sharing, right? But based on this assessment, right, my clinical recommendation is going to be just that, right? And it may not be something that you are wanting to do, right? And then, of course, they have the autonomy to do whatever they want, right? But to make a clinical judgment, because oftentimes people have unaddressed mental illness, and to go into a residential program, a fully integrated residential program, they can get some of the diagnostic assessment done, to get some medications and get stabilized in order to even receive the substance use disorder treatment. So, I'll be remiss to send someone to an outpatient program. You have unaddressed mental illness, you have unaddressed trauma, right? You're homeless,
So many factors that are exacerbating
an
already injured person.
Yeah, and like Eric was just saying, people just you got transference, you got counter transference, counselors experience and clients do as well, and if you don't have the courage to say, I'm biased against this, right? I've had an experience and this person, this client, right, reminds me of this person, right? And it's difficult for me to usher in the level of compassion necessary, right, to keep that person in the seat, right? And they need to be able to have the courage, right, to say that, right? No one wants to tell the truth, right? They want to give the truth a different name. And it's not lie, right? It's Almost a lie.
Well, my grandmother used to say, a half truth is still a whole story.
Yes, it is.
So remember that. Now, this event that's taking place on the 23rd, the Opioid Overdose Forum, is taking place over the dinner hour.
Yeah.
5 o'clock to 7:30. Can you gentlemen talk to me about the significance of that? Because I believe, because we are African American,
you already know.
we have an understanding of what that means culturally.
Yeah.
However, in the gift of time, we're going to explain that to other people.
Okay,
Can you
go
talk
ahead.
about the
That's the easy one.
significance?
You want to talk? So, like, first of all, Caribbean Kitchen. So, like, Eric, they had an event over at the Capri Theater, right? And it's a wonderful event. And it was just food, so everyone was like, "Oh my God!" Like, usually I'll come and I'll get the food, but I was up for seconds and thirds, and so we couldn't get enough of it, right? And so that's one reason, right? But also, in this series, right, we thought that some using foods from different cultures, right, is something. So we started out with Caribbean Kitchen. And what we're trying to do is attract people as well, right? It is over the dinner hour, right? And so Caribbean Kitchen does a wonderful job on a few of their dishes. And so if you come, right, you won't be disappointed. So yeah, just having a lot of food, some of the culture and the vibe, right? And it's just setting that atmosphere, right? To get people to know, because most folks are, and I'm gonna just take a risk and say, most folks are still afraid of black people, right? When you give us an opportunity, right? When you let go of your guard, you'll see that we're one of the most caring and compassionate people on the planet.
Absolutely.
And it's breaking bread. Breaking bread together is just a cultural thing.
Yes, it is.
Food and eating and sharing. That's what it's about. Just sharing together and breaking bread together and addressing some of the issues, and mainly the elephants in the room. I think that's the big thing, is we need to address the elephants always in the room, and somebody's got to say it.
What is the elephant at large? I feel like I know, but I want to make sure viewers are catching.
Okay, the elephant in the room is that I think we're being left out. I don't, and sometimes I don't think we're being left out intentionally. Maybe from I don't know, but I just think that the process maybe needs to be shifted a little bit to address the whole. Not just us, them too. It's just the process needs to be shifted. You know what I mean? There's a deeper answer within me, but I think it's a little more deeper than what I need to express here and there. But yeah, I think it just needs to be shifted a little bit to address the needs of this population.
Now we know, and I'm talking about the three of us sitting here, how systemic racism can permeate the medical field, can permeate the rehabilitative field, because there is such stark contrast on services, on money, on resources availability.
Sure.
And even though a lot of the populations in which you serve are listed as underserved, we have to start to think about who is doing the underserving.
Exactly.
That's right, and that's exactly the thing. What this event is for, to address them, because it's mostly them who are trying to serve us. And like I previously said, it's kind of like we can do them, and I have seen it. But I've been over 20 years providing clinical services, and over those 20 years. Not saying that they can't make breakthroughs for clients, but it's more not more harder. I'm not going to say that. It's a more of a challenge for them if they don't address some of these biases and the harm. Understanding what is cultural Pacific services and things like that, and understanding how decision making in substance abuse and MAT services affects those individuals from populations that you might not understand. You know.
Cultural competence is important.
Yes.
It is very important. Now, for anyone watching this that is a clinician and or professional or practitioner and wants to participate in this event, is there any cost associated and or pre-registration necessary?
This is cost free.
Okay.
Free to come. Please come. Break bread with us, get this information, and come back, right? Now, throughout the series, these forums, there'll be no cost for admission. Right? However, if you'd like to leave a donation, right, that's acceptable as well. But it's totally free.
Now, for those that are interested in navigating some of the community resources that will also be available at the event, can you talk about what those may be?
All right. So, Turning Point treatment inpatient, residential and outpatient, and transitional housing. They'll have a table there. Twin City Recovery Project, their youth division, will be there. Ethos Recovery up in Spring Lake Park, they'll have a table there. Of course, African American Survivor Services, right? We're excited about talking about this new mobile access unit, right, that we're about to launch, right? So we're pretty excited about that. So yeah, there'll be a variety of providers, resource tables. The event is totally free, and I encourage everyone to come on out.
So we invited Continuum Care will be there, Lotus Recovery and Treatment Center. Who else? What is Ken with?
That's Ethos.
Ethos.
Yeah.
I think I think he got them all. Yeah.
Is this event going to be live streamed and or recorded for those that are not able to attend in person? I'm sure there's a certain level of anonymity that needs to be kept for privacy purposes, but also so that people can feel comfortable to keep divulging. But is any of this going to be shared with the public so that people amongst our networks that are not only watching this, but also a part of you all's organizations are able to start
Well, we hope that we hope that you record and share this.
We definitely.
And we are going to be recording the event, but as far as put it out publicly yet, I don't know. We haven't discussed that, so we will discuss about putting it out. But
but it definitely will be recorded.
Now, please provide the address of where everything is going to be taking place for those that may want to attend.
Yep. So that's 285 North Dale Street, St. Paul, 55103. It's inside Lutheran Church of the Redeemer.
Okay. And then for those that are interested in staying connected to the work of Continuum Care and African American Survivor Services, how can you provide us with your contact information?
Our contact is www.aasurvivorservices.org, or I can be reached at 612-306-3416. And again, we are officed as well at 285 North Dale Street. Right.
Okay. And Eric?
You can reach me at Continuum Care Center. That's CONTINUUM carecenter.com. Or you can reach me at 651-703-3336. And you can leave a message there and I'll get right back to you.
Now, lastly, for anyone that is interested in coming but feels maybe a little hesitant about talking about this subject matter, because it is heavy and it is impactful not only to communities but families and those that love them. Can you just give them a word of encouragement or a call to action to tell them to get the ball moving, line up the ride, give somebody some bus fare so that you can come to the forum on the 23rd?
I'm going to speak for Survivor Services, right? If there's someone that is experiencing any type of apprehensions about coming, right, or in need of a ride there, we will come and pick you up, right, and treat you as warmly as we do anyone else. If there's some content that makes a person uncomfortable, we want to talk about that. And that's exactly what this is about. Because we understand that, if you're not willing to be uncomfortable, you're not going to grow.
That's true.
So I would say, please come and get the education and resources that we have to give out, and the things that you'll learn will be beneficial to you of supporting people in our community who suffer from this dreaded disease. That's the main thing. We don't want you to miss out.
No.
You can get information on how to get trained. I think everybody in the community should be trained with Narcan, so they can be able to save a life if necessary. You know, I think that's very important, and support nonprofits, and especially Black nonprofits. You know, in our community. So that kind of thing is very important. So.
Now, as the summer is approaching, are you all going to be out in the community at events so that people can connect with you and or your team specifically?
We will. Right, like I said, mentioned before, we're excited about our mobile access unit, and so we'll be everywhere Juneteenth. We've been invited down to George Floyd Square, May 25th, 24th, and 25th. A lot of stuff in Hennepin County, a lot of stuff in Ramsey County as well, and in Washington County, the state fairs. We want to start to make the conversation around opioid overdose a norm in the household.
Absolutely.
Yes. Yeah.
Absolutely. Well, thank you, Eric and Ivan, for joining me, and thank you for hosting this wonderful addiction series to continue the conversation in our communities and abroad.
Well, thank you.
Thanks for having us.
Thank you.
Absolutely. Unfortunately, that is all the time that we have for today's episode of Community Connections. A very special thank you to today's guests, Eric Bacon and Ivan Nelson of Continuum Care Center and African American Survivor Services for the work that they are doing across the Twin Cities. Please be sure to contact them at their provided contact information, and tune in to the event that is taking place, the Opioid Awareness Forum, on the 23rd. Thank you for joining me. As always, I look forward to connecting again with you soon. I have been Anna Orr. This has been airing on OROMIA11.